Good morning, everyone. Welcome to today's live update. I'm Chancellor Donde Plowman. I want to start by thanking all of our students in our on-campus housing for their commitment to our community testing protocols and our safety guidelines. Our high participation rate in the testing means we can have confidence in the low positivity rate, which we are seeing each week. And I'll explain more about that in just a minute. Thus, as you were all notified yesterday, we are lifting visitor restrictions in the residence halls and in the sorority and fraternity houses because of the way the data is looking. We will, however, continue to watch our participation and prevalence rates and make adjustments if we need to. Now, here's some good news. Just some more good news, I guess I should say. Just 2 weeks ago, a publication called College Magazine ranked our campus's response among the top 10 colleges and universities they ranked. We ranked number 5 among colleges and universities across the country for the way in which we have responded to COVID-19. I'm extremely proud of this recognition, and I want to thank everyone on this campus who has had a role in that, whether it's been preparing for our return to campus, adjusting to new circumstances during the semester, or simply practicing the health guidelines we've put in place. Thank you to everybody. That recognition matters and it makes us all feel good, and we still got work to do. So this is all good news, both the participation in the testing and the ranking we got in College Magazine. But I also want to remind everyone, this is not the time to let down our guard. The prevalence of COVID on our campus remains low, but cases are spiking around the state and around the country. Please remain diligent in practicing the social distancing, in wearing your mask, washing your hands, and taking other precautions. We'll talk a little bit more about responsible behavior, especially ahead of your return home for Thanksgiving shortly. But first, we're going to go over the most recent data and case counts. Then I will be joined by Dr. Spencer Gregg, Provost John Zomchik, and Vice Chancellor for Student Life, Frank Cuevas. So let's get started with the data. As of yesterday, you can see on this chart, we have 72 active positive COVID cases. Now, 61 of those are students and 11 are employees. This total also includes 13 new recoveries, which we pulled out of there. So let's look at the next chart, which is the number of new cases. What you see is, of course, this pattern looks exactly like the previous chart. Big spike in September that we've been driving down, and now we've to some degree plateaued. So what this says is that there were 10 new active cases yesterday. On the next chart, which has become familiar, this is the one that shows the number of people we have in quarantine or self-isolation. So take a look at this. Right now, we have 324 people who are in either quarantine, which is when you're a close contact, or isolation, which is when you've tested positive. Of those, 282 are students. So considerably down from what we had during that huge spike in September. Now we've added a table to the dashboard, which is right here. And I want to walk through this because it could be a little confusing to read. What we're doing here is reporting out on the community saliva testing. We often refer to it as pooled saliva, because let's think about what we're doing here. We're collecting saliva and it is being examined first in pools. So 3, 4, 5 people samples at one time. So let's just take a look. Let me help you with how to read this chart. So let's just go across the bottom there. On October 19th, we were testing in Clement, Volunteer, Laurel Hall, and we also did makeup tests for those who had missed the test earlier in the week. What you see under participation rate is that on that day, we had 77.5% participation rate. That is, we're really happy about that number. Of course, we're shooting for 100%, but there are some reasons why not every single person is participating. They may have already had COVID, or they've gone home for the week or something like that. So 77.5% of everyone who was supposed to participate did. We took 1,341 samples, okay? So on that day, we collected 1,341 samples. Those samples went into pools, and the typical pool size was either 3, 4, or 5 people. So of the 1,341 samples, they were placed into 361 pools. So if you're following me, 361 pools, each pool had either 3, 4, or 5 samples in it. So when our lab, our faculty, our researchers looked at the pools, what they found was out of those 361 pools, there were 14 of them that they called for the moment positive. What they could see is evidence of the virus in those pools. At that point, we don't know which individual or how many individuals. So on the basis of those 14 pools, 62 individuals were notified that your saliva was in a pool that looked positive. We need you to come to the health center and have a PCR test to determine if you have COVID. And what you see there is out of those 62 individuals, 8 people had a positive diagnostic test. So we're really happy with those numbers. It's a very low positivity rate. And when all the students participate, then we can have real good confidence in what those positivity rates mean. So before we get to the questions for Dr. Greg, I want to point out that our dashboard, which you can find at utk.edu/coronavirus, has recently received an A rating by a group of respected academics and doctors who are evaluating campus dashboards. So there's another indicator that we're proud of, that our dashboard is effective at communicating what's happening on our campus, both in terms of the number of cases and the testing and what we're doing. Ours received very high marks for the ease of use, for the breadth of the data, and the regularity of the updates. So again, I want to thank everyone who has been working so hard to keep our campus informed, and really proud of that rating. Way to go Vols. So Dr. Greg, I've got a question for you. Let's start with, what are you and your team seeing in the data this week, the data that I just shared there?
Good morning, Chancellor. It's good to be with you again this morning. Happy Halloween.
Thank you.
We're pleased to see how our numbers have been playing out on campus this week, and actually this entire month. Certainly, for now at least, we appear to be doing better than what we're seeing in other areas around the state. We were concerned that as more testing was performed, we might actually see a significant increase in our numbers, but we haven't. Students have done an awesome job of involvement with our testing efforts, and with that, we've still seen a general leveling off of both active and new cases through the month. We continue to see that a lot of those self-isolating are doing so because they can be identified as a close contact of a confirmed positive case. This indicates that we need to be much more careful about our social distancing practices.
Okay, so let me just repeat there. That means we've been in all the dorms, the sororities, the fraternity houses, and we're really happy with the way students have been participating. We've got kind of a rhythm going, and we've been telling students for some time now in the spring, this is something we'll be doing very regularly, much more regularly than we're now doing. So let's talk, Dr. Greg, just a little bit more. We've got a month left in this semester of on-campus instruction. What concerns do you have right now?
Well, a few things come to mind. First, I know that this weekend, particularly Saturday night, Halloween, is a time of celebration or parties for some. I think it's important for everyone to remember that despite what we're experiencing on campus, Knoxville and other surrounding communities have seen recent increases in COVID cases, including the need for increased hospitalizations. So it's imperative that we continue to adhere to our health and safety guidance. That includes particularly avoiding group social gatherings, get-togethers, or parties, and remembering to keep our distance from others and being especially mindful of the importance of wearing a mask. It's important as we close out the semester, we can't become complacent in our efforts. Many communities are seeing a second surge of cases, and it could happen to us as well. Adhering to health and safety guidance is just as important now as it was at the beginning of the semester. But also, this is the time of year when we typically start to see an increase in flu cases. So if you've not gotten your flu vaccine, you should do so now. Vaccines are readily available at the Student Health Center pharmacy, as well as other sites throughout the community, and we'll have some additional vaccine events on campus. And finally, toward the end of this month, I'd like to encourage students and employees to consider their health status and exposure risks before gathering with their family and friends for the holidays. The Student Health Center will continue to have COVID-19 testing available, especially for those who may be planning to be around others more vulnerable to infection. Students can be tested or pick up an Everlywell COVID home collection kit at the Student Health Center. We also now have those kits available for employees who'd like to be tested. These kits will only be issued to those who are free of symptoms. More information about the use and availability of the home test kits can be found on our website at studenthealth.utk.edu.
But again, even in this time, if a student feels like they're having symptoms, they're to come to the health center and you'll do the other kind of testing.
Yes.
Okay, great. Okay, so as I mentioned at the beginning of our update, we've lifted restrictions, visitor restrictions in the residence halls. That's really the last of the restrictions that we had put in place in September when we were experiencing all those numbers. I want to ask Vice Chancellor Cuevas a bit about where things stand for our on-campus residents. So, Frank, thank you for being here this morning. When we put these restrictions in place about a month ago, we all agreed it's not something we wanted, but rather something we felt we needed to protect our campus. How did our students respond?
Well, happy Big Orange Friday to everyone. First of all, I want to thank our students showed a tremendous amount of resiliency, patience, and cooperative spirit while we had all these restrictions in place. And as evidenced by, as you shared earlier, we lifted the last of our restrictions in place. They were very diligent when we were doing the pool saliva testing, that if they missed their day in one hall, they were going to other makeup days or going to another hall to make sure they provided their samples. So they responded, and because of their response and our low positivity rate, we were able to lift those final restrictions. So hats off to our students because they were very committed, they complied, they were conscientious, they were letting us know, I'm out of town, but I'll be back in town, or I missed my window, can I go to this other building? They were taking those initiatives and those steps, and that's what really drove a lot of our participation rates to be high. So they were, my hats off to them because I think we're very proud of their level of engagement in that process.
You know, Dr. Cuevas, I know that you've met with many student organization leaders. I've met with some myself, and it really feels like we got into a rhythm this fall where we're all working at this together. And I'm just really proud of everyone. I've said this before. I've been teaching a class one night a week, face to face. I have not one time had to ask a student to put their mask on. Everybody just, it's been really remarkable, and I'm grateful for everyone's efforts. So here's another one for you, Dr. Cuevas. How are our students who are in quarantine and in isolation, how are they doing, and are they getting the support and resources they need?
Yes, the short answer is yes. We have a team that is reaching out to all of our students in isolation or quarantine housing. This month alone, we're averaging at least contacting those students at least 5 to 6 times a week, reaching out to them to check in. How are they doing today? What do they need to make sure that they're not falling behind academically? And if they have concerns, we're directing them to either to the right resources or in making sure that we provide the support we need, that they need to be able to be successful while they're in isolation. We will continue to do that and provide those students in isolation and quarantine that touch point, that contact to them, because we know when they go into isolation or quarantine, it can create some anxiety for some of our students. And we want to make sure that there's someone here who can provide, who's available and will provide support and direct them with resources to make that personal contact.
So thank you, Frank. I visited Massey Hall myself, which is the hall we now have for isolating students who've tested positive. It will be in operation, am I correct, again in the spring?
Absolutely, everything is prepared there. Daily meal deliveries to ongoing food throughout the day, snacks, what have you, to make sure that our students not only have basic needs, but also as when other issues come up, we're able to respond to them and connecting them with colleagues in either student success, their faculty, and so forth, so that they can continue to be successful while enrolled in school.
Okay, I was impressed with the services I see going on over there. So thank you very much for that. So let's talk a little bit about the end of semester plans. Um, we need to be thinking about how we're going to close out the semester. Our students and their families are beginning to plan their return home for Thanksgiving, where they will remain until they return for spring late in January. And we want to make sure that they do this responsibly and safely. And Dr. Greg, you were referring to this earlier, but I want to drill down just a little on some of the specifics. We're encouraging all students to get tested before they return home. Can you be a little bit more specific? When should they do that? And how exactly do they go about doing it?
Well, you don't want to be tested too soon, but you also don't want to wait to the last minute. Sometime during the beginning of the last week that you plan to be on campus would be ideal. That way you have time to get your results back before you leave. The average turnaround time on results is 1 to 3 days, and that's dependent on the test that's performed. Asymptomatic students and employees can pick up an Everlywell COVID test kit from the Student Health Center. The turnaround time on results for those are 2 to 3 days. Also, students without symptoms can schedule an appointment in our COVID clinic where they can get a test with a turnaround time of 1 to 2 days. Students and employees that are having symptoms will need to be evaluated by a healthcare provider prior to getting tested. So symptomatic students can schedule an appointment in the sick clinic at the Student Health Center, and employees will need to arrange an appointment with their private healthcare provider.
So when you pick up one of those test kits, if I'm asymptomatic and I think, hey, I want to take this home and just test anyway, where do I return what do I do with the test kit after I've taken the test?
Well, we provide a lot of information
Yeah.
to the individuals that are receiving that, but as far as once this sample has been collected, it has to be returned that same day to the Everlywell labs. And there's a prepaid United Parcel Service or UPS sticker that they can place on the box, and they can drop that off at any accessible UPS drop box.
Okay.
And we also have the drop off here at the Student Health Center.
Okay. That's what I wanted to know. So really clear instructions in that. And we've been using them for successfully this semester. So just one more thing, Dr. Greg. So of course, testing negative once doesn't necessarily mean that students are in the clear. Now, let's talk about that a little bit. What else do they need to do to keep themselves and their family members safe?
Well, you're correct. The test is really only beneficial when it tells you that you're positive. A positive result should prompt you to reconsider your plans and discuss that with your family and friends. You'll still need to isolate for 10 days if you're positive. If your results are negative, well, that's great. You're negative that day, but tomorrow things could change. So the negativity doesn't mean that much, because negative doesn't mean you don't have anything that you need to worry about. You still need to adhere to all health and safety guidance to protect yourself and others. Remember to wash your hands often, avoid close contact with others, cover your mouth and nose with a mask when you're around others, cover your coughs and sneezes, clean and disinfect frequently, and keep a close eye on your daily health. Stay home and away from others if you feel ill. Get tested, monitor your temperature, and don't forget to get your flu shot.
Okay. I've gotten mine, so it didn't hurt that much. So we're on the clear there. Dr. Greg, thank you so much. Finally, I want to turn to the academic portion of this unique end to the fall semester. And so, Provost Somchik, I got a question or two for you. So here we are, we're in the thick of the semester, and this is a time when time management becomes even more important for all of us, but especially for our students. So, Provost Somchik, what resources are available for students to help them be successful if they're starting to feel out of control, overwhelmed a little bit?
Thank you, Chancellor. Yeah, we are in the thick of the semester. I think we're in the home stretch, and our students have been doing so well, but we want to make sure, just as we want to keep them healthy, we also want to make sure that we keep them academically sound. So we've got resources for our students so that they can this really unusual semester. Our Vice Provost for Student Success, Dr. Amber Williams, and her team have put together a rich selection of resources so that students can manage the challenges that kind of begin to pile up towards the end of the semester. The days are getting shorter, the temperatures are getting a little cooler, fall is here, it means final exams are right around the corner. So what I want to recommend to our students is that they log on to studentsuccess.utk.edu and look at the resources there. I want to especially recommend that they watch the motivational videos that Dr. Williams has posted on that site. She is a terrific motivator. I watched them and I felt energized after seeing those videos. I want to call special attention to her reminder to our students to show up and to show out, as she calls it. What she means by that is that it's really important to continue to attend your classes, whether you're attending in person or virtually, and to be prepared to be engaged with your classes. This is part of your responsibility as a student. So listen to Dr. Williams, be inspired by her motivating talk, and come to class and get ready for final exams. There are lots of other tips on the website, everything from Chancellor, as you manage, the importance of time management as we get closer to final exams, the importance of continuing to communicate with your instructors, suggestions for making the most out of the study time, and also some really helpful links about technology. If you need a sort of refresher, for students who need a refresher about technology. Great links there on that website. So again, studentsuccess.utk.edu, and don't miss Dr. Williams' motivational videos.
I'm going to just go right straight to those as soon as this is over. Well, listen, that's all we have for today. Tomorrow is Halloween. And I know it's traditionally a fun holiday that our students enjoy celebrating. This year, doing so responsibly takes on a whole new meaning. Wear your cloth masks. I've got mine right here. It's the perfect accessory to your costume, no matter what it is. Be socially distant and be safe. Thank you all for joining us, and we will see you back for our next live update in a week. Go Vols.